Welcome to the Wistar Institute's HIV Cure and Viral Diseases Center. Through our research in BEAT-HIV, we have assembled a team to discover novel tactics and approaches that will help us both control and hopefully eradicate HIV infection.
With iCure, we're advancing the latest HIV strategies through personalized medicine for a person-specific cure.
All these projects involve the community to ensure research asks the right questions to help people living with HIV.
As well as engaging the next generation of researchers to ensure that we're equipped to continue in the fight.
We bring all these programs together here to advance the science, get us towards a cure for HIV and other viral diseases. The history of HIV cure research at the Wistar Institute spans over 30 years, a long-standing commitment to bringing scientists and community together towards a cure. BEAT-HIV is part of the Martin Delaney Collaboratories for advancing us towards an HIV cure. And it's been ongoing for over 9 years, bringing together over 90 participating investigators and community members and over 40 academic and industry partners.
The biggest challenge in the HIV field is to find where HIV hides and how so that we can target them. Through this BEAT-HIV collaboratory, we use single-cell multi-omic technologies to find HIV are actually leveraging this host immune program called tissue residency through a transcription factor called BAC2. We can design many ways to target BAC2 and remove HIV from the body.
Cell-mediated therapies are really at the heart of the approaches that the BEAT-HIV is taking. We focus on a population of lymphocytes called natural killer cells. We've even identified, very rarely in persons living with HIV, HIV-specific natural killer cells, and we've developed strategies to not only expand these cells, but also enhance them.
CAR T-cell therapy is the strength of BEAT-HIV. We have a lot of expertise in designing CAR T-cells to control cancer, and we can make T-cells so that they can outfox HIV and control infection.
The best part of the BEAT-HIV collaboratory is that it combines not only basic scientists, clinicians, but also people from the community.
The BEAT-HIV Delaney Collaboratory recognized the value of bridging the basic clinical and biomedical science with community realities very early on in the process. The social science, we assessed factors like acceptability, visibility, implementability of HIV cure-related research in the real world. Having a social science and ethics working group can help us anticipate some of the possible ethical considerations. We need to make sure that we avoid widening disparities.
Through BEAT-HIV, we're at the point that we can combine these interventions and we are one step closer to curing HIV. Probably the solution will be an individual solution for each individual. It will not be something that will work for everybody.
The Individualized Cure, or iCure program, is the outcome of discoveries made through the BEAT-HIV collaboratory.
iCure is a new collaboratory of researchers brought together to focus on a personalized cure, to put all of our most potent therapies together and say, what could an HIV cure look like? The iCure approach consists of 4 major stages. First, to create personalized LRAs that'll wake up the virus, so the immune system can then see it and target those cells.
What we hope to do is, from a single blood sample, amplify and sequence the viral envelope protein, which is the target of neutralizing antibodies. We can then infect cells in the presence of the person's own antibodies and see which of these variants are not neutralized and would therefore need to be included in an RNA vaccine.
Second, to create a personalized mRNA therapeutic that will boost the natural immune response.
We and many others have shown that RNA vaccines are incredibly effective against HIV. You can very rapidly make RNA therapeutics that target specific antigens that only that person has.
Third, to create personalized cellular therapies like CAR T cells and engineered NK cells to find and kill virus-infected cells.
It really presents us the first opportunity to bring modern NK cell-based products along with other cell-based approaches to really use those together to try and focus on an HIV cure.
and then to sustain therapy and to sustain response with novel bispecifics.
We design personalized cure strategies by characterizing specific components of an individual's clinical background. By understanding their virus history, their cellular and antibody characteristics, we can design a personalized care strategy for any person living with HIV.
If we could personalize the approach to a cure for each individual based on their profile, based on their characteristics, how the virus shows up in them, things like iCure becomes a game changer.
Community engagement has been a priority because they're an integral component of our research effort. They're the reason that we are working towards an HIV cure.
Philadelphia Fight is a federally qualified health center. We're committed to serving people living with HIV or people who are at high risk of acquiring HIV and many others. We started a partnership with the Wistar Institute almost 25 years ago. This partnership is grounded in community engagement and mutual respect.
BEAT-HIV and projects like iCure are very important to the community, for the community to understand clinical research, the direction that they're going with a cure, to participate in papers.
I'm a graduate student researcher at the University of Pennsylvania. So I serve as a support for those living with HIV, as well as serving my undergraduate and my graduate peers. If you don't believe a problem to exist, our generation won't try to solve it. Introducing that there is no cure, we can help inspire the current generation to keep pushing for one to happen.
Under the umbrella of the HIV Cure and Viral Diseases Center, we're all aligned. The advances in science that we can move forward, the strategies that we can develop towards clinical interventions, and the community support that wants to see these strategies make it to the clinic, together advancing the science forward.
As a global pharmaceutical company, we partner with BEAT-HIV and iCure because collaboration speeds progress. By pooling our collective expertise, science, and capabilities, we can accelerate the pace of research.
Curing HIV is a very hard thing to do. It will only happen when people combine their expertise so that the sum is greater than the whole.
Research directed towards an HIV cure will have benefits that go well beyond HIV. We will gain insights into how to better design cure strategies for other viral diseases.
What matters most to the community is that we show up for the scientists and the scientists show up for us. We're asking everyone to be a part of helping us get to the end of this so people could live free from HIV.